this is Dr. Derry Rogers. Why did I choose to become a part of Dental Partners? Dental Partners certainly provided the best commitment long-term to clinical excellence and to collegiate, which I felt was very important in the pursuit of clinical dentistry. Also gave me the freedom to continue to practice the way that I currently do without any interferences in the practice management zone, the management of patients, the management of staff. The alliance between ourselves and Dental Partners would enable me to continue the care that we've become known for delivering to our patients for the last 30 years. I'd like to see Dental Partners become the premier corporate group for young and middle-aged dental practices to involve themselves off the back of understanding that there is an absolute commitment to clinical excellence and to training and to support and all of the things that I believe are necessary in my view of the delivery of clinical dentistry in this day and age in the new millennium. In terms of how things have changed since joining Dental Partners, there hasn't really been a major change. They haven't interfered with my practice in any shape or form. They've been supportive in whatever way we have requested, whether it be the purchase of new equipment. It has taken away some of the logistical issues related to payrolls and the like, and covering orders and those areas of overhead management. I'm looking forward to developing friendships in the short and long term with other dental partner practices.
Hi, I'm Tony Buvere from Canberra. I chose to become a part of Dental Partners because I realised that my practice was probably too large to sell to an individual buyer, and eventually chose Dental Partners for two reasons. One, because I liked the people involved, and secondly because they specifically said no clawbacks. So it was a very easy arrangement to enter into. Economies of scale would translate pretty well to the practice of dentistry. So I chose to build a multi-practitioner practice, and that's pretty much where we are. Being a part of Dental Partners, though, has got lots more advantages than just the financial rewards. Being part of a larger group is really something special in dentistry. The practice will pretty much stay the same because the organisation will protect it, encourage it if you like, cosset it, and just make sure that things continue to work the way that they do. Have a corporate image that bespeaks high-class dentistry, professionalism and community service, all the things that we stand for in dentistry, and it'd be really nice to see Dental Partners highlight and incorporate all of those. When I'm asked what I enjoy most about Dental Partners, it's important to be really honest. So I'll be really honest. Kath Pillage and Trudy Weaver. That's what I enjoy most about Dental Partners. I like Mike. I think I'd describe him as an onion. The more layers that you peel back, the more you find underneath. And I think one day he'll probably make a really passable Australian. Only dentists understand dentists. Always refreshing, encouraging, rewarding, and it just helps to consolidate your approach to so many things that make dentistry so damn difficult. What we're trying to do here is to provide a worthwhile forum where people can talk to their peers. That's what I hope that in this advisory council we're able to give. Older guys who've perhaps been around a little bit longer can quite humbly say, perhaps you should look at this.
Hi, it's Michael Tam here from North Sydney. I am originally from New Zealand, please don't hold this against me. Why I chose to become part of Dental Partners, basically got the sense from them that things were pretty much business as usual. The right to clinical autonomy and patient care, which was critical for us as responsible treating clinicians. I'm a general dentist with a special interest in cosmetic and dentoalveolar surgery, being predominantly wisdom teeth and implant dentistry. Started in Australia with my first placement with Derry Rogers, the king of cosmetics, in 1995. The best thing about Dental Partners is that we never really hear from them. In regards to my vision for Dental Partners, I would hope that with the forward progression of Dental Partners that I may continue to evolve and maintain a win-win relationship for all involved. Under the stewardship of Mike Timoney and team, we will go far. What I like about Mike is that he basically says it how it is. Certainly a personal touch factor here. Response is pretty quick and they are only a phone call or an email away. We are on an exciting journey forwards with Dental Partners, and I would like to help contribute to its forward progression and growth.
Hi, my name is Stephen Herriot, orthodontist. Why did I choose to become a part of Dental Partners? They aligned nicely with my vision for both family, professional and financially goals for the longer term. Two offices, one at Burleigh Heads on the Gold Coast and one at Tweed Heads, just in New South Wales, and so it really does make it difficult for us at times of state of origin. I appreciated sitting down with Dental Partners because they sat with me and formulated a plan which would work for me. I guess most importantly helped me achieve the vision of my new office without the considerable financial strain. Dental Partners enabled me to release the equity from my practice at a far more profitable level than I would have achieved selling privately. It doesn't matter how tight the legal arrangements are, in the end it comes down to personal relationships with the people who are running the show. I felt quite comfortable dealing with Mike Timoney and his team. He really listened to me when I was discussing how we could finance the building of the new office and getting things moved. He understood the stresses that I was under at the time. I think this is fair and equitable in the real world, and it does give us some incentive to achieve work and reward for effort. How do I feel after being with Dental Partners for 1 year? The word is comfortable. I enjoy my orthodontics a lot more because I've got these lovely new premises to work in. The biggie is I don't sign the checks at the end of the month. That was always a bit of a downer. Dental Partners really don't interfere with my daily running of the practice. They can be recognised as a place by patients for quality care, with an emphasis on caring, preferred places of employment. So what do I enjoy about working with Mike Timoney? Well, apart from being a POM and being able to pay him out, apart from his Bluetooth granuloma attached to his left ear and his appalling sense of dress, Mike is a likeable bloke. He's easy to approach. I can go straight to him. He has great team support and seems to be able to get the people behind him. If he is not strong in an area, he'll find the people to support him and back him up. And he is so energetic, sometimes you have to put the reins on him to slow him down a little. What I've noticed with Dental Partners is when times get tough, they don't focus on the negative. Splurged out on their office managers for the people who really needed a pat on the back, and that just helped the morale of the practices and the leader of the practice work more comfortably. You'll want to know how to achieve more out of your practice. Can we advertise more? Can we do this? Can we do that? If you want some help, he'll give it to you. If you want him to stay right out and let you do your own thing, he'll be just as supportive. I hope to be able to keep working with Dental Partners for many years. It can be a lonely business in our little offices, and every now and then we've got to put our head up and get out, enjoy life, and I really appreciate Dental Partners giving us the opportunity to do that.